Greetings, God bless. So, some years ago, I was having sinus infections, and I would do the neti pot. And I asked, it took a lot to get to an ear, nose, and throat doctor in my area, but I finally did. And it was it was just not a good experience. And they, inserted, like, I guess it was like a camera, and then the doc whipped it out of my sinuses like rapidly. It was just, I don't know, it just seemed pretty brutal. And he was like, yeah, everything seems clear. And I kept on having just a lot of drainage in the front, and like down my throat, and just a lot of irritation. And then I started just paying attention. So, because it wasn't just like watery mucus that would come out, there'd be these um, blobs that would get stuck, and they would get stuck in the airway. And it just was just so uncomfortable to go outside, because there'd be, I guess, like condensation, or I don't know what, but it would cause just like my nose to drain, and I would just be having a drippy nose all the time. So I started paying attention, um, and just recently, I don't know, for some months, I've been like, okay, instead of trying to blow my nose and get a hinky, I would use a Q-tip to just dab, and and it would uh, absorb not only some of the moisture but these globs. And so prepare yourself. This is a bit graphic, but I'm wondering if this will show up. Okay, so now, I've been, struggling with stuff like this, right? And so recently I've learned of, it's a type of thread worm. It's called strongyloides. Now, I don't know if this is it, and uh, I rarely ever get to see, and it's like stuff you don't really want to see, is what is a parasite? What does it look like? So I don't know if this is strongyloides. I don't know if this is even a parasite or whatever, but I'll get these large things. And like at one point, that ENT, he was like, well, let's do a CT scan. And then after the CT scan, he was like, let's do an X-ray. And he was like, okay, let's do an operation, turn your face inside out. And and I was, number one, I was like, no. But number two, I didn't ask him, why would you want to take my face off and put it back together? Like, and he was like, okay, you're fine. You know, like, he wanted to do an operation, but when I wouldn't, he was like, okay, well, everything's fine. So I'm thinking that perhaps there's like, a colonization of, of something there that they remove, because I think that's what operations are, is just removing the parasite load, and people get better because the like, from what I understand, is it's not so much the parasites themselves, but uh, the waste of the parasites, or the body, like the like when we're around a lot of toxins, or when we're around 5G, parasites don't like that, and so they excrete their own body chemicals that irritate our nervous system. So anyways, I think there's just this big lie or conspiracy of silence about parasites. Medicine depends on neglecting identifying the presence of parasites and Lyme co-infections. I think that, along with environmental toxins, just poisoning the air, water, food, our minds with media and psychotic politics. So that all is a burden on our health. And and then we're just blamed. Oh, you you eat too much salt, you eat too much fat, or something like that. It's your fault. When in fact, we're in the soup of poison, of evilness. So, anyways, my point is that I feel like parasites are not talked about. We don't really know much about it, um, and we're not really aware that they can not only harbor, like, be in our gut, but they can be in our sinuses, and sinuses are a big place for threadworms. One of which is strongyloides. So, anyways, I just, if tissues aren't working for when your nose is running, I think it's good to dab with, round with a Q-tip very gently. Also, you might want to moisten the Q-tip because it can really actually, like, even though your nose is dripping and draining and stuff, the Q-tip can overly dry. And of course, make sure it's sanitize, like, it not well, don't sanitize the Q-tip, but make sure it's sanitary. Like, make sure it's a very clean Q-tip. Don't use something that's just been around, because if you apply something that's been, like, on the floor and you put it on your nose, you could give yourself an infection. So, of course, this isn't medical advice. This is just my experience of having a lot of nose draining. And when a tissue isn't good enough, the Q-tip can get, like, just it can soak up more. I don't know why the Q-tip maybe it's just a little bit more absorbent. So I think that's it. And so, what to do when you have a parasite infection, possibly? And again, it's like, work on all of those environmental issues, that try to filter your water and your air, and eat good quality food, and do lifestyle things that help your body detox, um, and take probiotics. And also, it's good to probably look into a parasite cleanse. And in the olden times, people always did parasite cleanses, but it's not in fashion. And parasite cleanses aren't that fun, I mean, it's a bit, it's kind of a paradigm shift. But you know, you deworm your cats and dogs, or you should. And not only that, we should work on ourselves as well. So, thanks for watching. God bless.